We're here today, hopefully, to give everyone a better understanding of what blood pressure is, what constitutes high blood pressure, or what we call hypertension, what causes it, how do we diagnose it, and how do we treat it. So hopefully at the end of this time, you will have more information about all of those areas. Hypertension, obviously, is something that is very, very prevalent. And so, as we begin, we want to talk about blood pressure itself, so that we're all grounded in exactly what's going on. So, what is blood pressure? Well, it's essentially the pressure exerted by blood on the walls of the blood themselves. Now, changes in our body can make a difference in that blood pressure. Some of those are the strength of the heartbeat. The harder the heart is beating, what would you expect to happen to the blood pressure? It would go up, exactly. Of course, the opposite is true. The less well the heart is beating, then of course the blood pressure would go down. The thickness and the volume of the blood itself. Someone who has a very high hemoglobin that makes the blood very thick and concentrated, will that take more pressure or less pressure to push through the blood vessels? Exactly. Very good. More pressure. So those who have anemia, which is the opposite, lower blood volume and not as many blood cells, would then have a lower blood pressure. The elasticity of the artery walls themselves. Within the arteries, there is part of the wall function that almost dilates and becomes elastic, if you will, so that it can change. It can get larger, it can get smaller. And when that happens, then it can either lower the blood pressure or raise it. And our general health makes a big difference. Normal characteristics of blood pressure are dependent on the role of what we call the baroreceptors. These are certain cells in our body that tell us, and our brain particularly, when we are changing position. Now, there are many NAs here, I'm sure. So, when would we consider our blood pressure to be the lowest? When we are standing, sitting, or after 10 or 12 hours of sleep before we get up in the morning. Exactly. When we are lying down, our blood pressure is at its lowest. Right. Okay? Now, as we sit and then as we stand, our blood pressure has to rise necessarily. Why? Because it's got to get up to our brain, right? We've got to push it back up to our brain so that we don't fall over. Many times you may have experienced this yourself. You're kneeling down or crouched down doing something and the phone rings and you hop up. What happens? Yeah, a little lightheaded and dizzy. That's because the baroreceptors didn't have time to fire and get the message to the brain that you had just changed your position so that they could get the blood back up there. So it's very important that we know when to expect it to be higher, when to expect it to be lower, and then how to interpret that. When we measure blood pressure, we will see two numbers. The top number is called the systolic blood pressure, or the SBP. The lower number is called the diastolic. Well, what does that mean? Well, the systolic number means that when the ventricle of the heart, the lower part of the heart on the left side contracts, then pushes the blood out, this is called systole, and this is the top number. Okay, what about the diastole, or the bottom number? This is when the lower part of the heart then relaxes to receive more blood for the next stroke, if you will, to push the blood out. So that is basically what we're measuring when we measure our blood pressure. So then, what is high blood pressure or hypertension? Well, we consider at this point a blood pressure measurement of greater than 140/90 to be hypertension. However, if an individual has diabetes as well, then we have to lower that to 130/80. Why? Diabetes itself brings its own problems with blood vessels. So once you have diabetes and the blood vessel problems that accrues, and you add hypertension, then you get a double dose. So you're going to have to diagnose it a little bit sooner. It turns out, as you would not be surprised, I'm sure, to know that hypertension is the most common primary care diagnosis. It accounts for 35 million visits to primary care each year. Unfortunately, at least 30% of the individuals who have hypertension are totally unaware. Why is that? Well, sometimes you may hear hypertension called the silent killer. And that's because, unfortunately, until one has had high blood pressure or hypertension for a long time and has already experienced the damage to other organs in the body, including the brain, the kidney, the heart, the blood vessels in the eyes, even the blood vessels in the limbs, they may not have any symptoms at all. In fact, their first symptoms may be a heart attack or another, what we call end organ damage. Now, some people say, well, I can tell when my blood pressure is up because I have a headache. Now, that's true sometimes. Sometimes for people, for some reason, do not have high blood pressure and then suddenly raise their pressure. Yes, sometimes some people can get a headache, but it is not always the rule. So we can't trust our bodies to always give us that cue that we've got hypertension. So we'll talk in just a minute about how we figure it out. These are the diagnostic tools that we need to make that diagnosis of hypertension. And considering the technology of modern medicine and looking at these tools, which I'm sure you're very familiar with and have seen before, what do you think about the high-tech, low-tech, expensive, or not so expensive nature of diagnosing hypertension?